I want to thank you, Boettcher Foundation, and also Web Growing Foundation to fund us and give us opportunity to pursue our career. I think this grant is so important and gives some bridge to do our research independent. So I just want to tell you about what I'm doing. So Natural Jewish is famous for lung disease. What I'm doing is one of the lung disease called Beryllium disease. So beryllium is a small molecule, small metal. It's light, it's very low density, and it's very widely used in industry because it can make metal harder and more valuable. And also use all kinds of industry, electronics, defense industries. And most disease is happening for the miners. So this kind of very related to Colorado, you know. And because they breathe those mining dust, they have beryllium in there, they got lung disease. And so that's why this is very related to Colorado. And also about 80% exposed work to those dust, beryllium dust, got disease, and estimate of 18% of exposed workers. But this disease is only happening to people who have a certain gene. So this gene called HLA-DP. So if the DP have one of the residue is glutamine, then you will get disease because this gene somehow can bind to the beryllium, causing disease. And only about 20% or 30% of people have this gene, so that's why they have a disease. So we saw the structure around this HLA-DP2 with the beryllium binding domain, so we know how those beryllium bind to this pocket on this DP2 molecule. And now we have a structure in hand, so we're planning to do some kind of drug design to cure the disease. So the theory is very simple. So we design some chemicals combined to this glue 96, and so preventing beryllium binding to this molecule. In this way, beryllium cannot bind to this gene expressed protein called DP2, then they won't get a disease. So we have screened a lot of libraries and do a lot of designs based on our structures. So we find some very promising drug candidates. So in my proposal for the Boettcher grant is testing those chemicals. So we will do three ways in parallel. First, we will test these chemicals in cells, so all kinds of human cells, to see if it can block the disease. So preventing those cells secrete certain chemicals. And then if this works, we can test in patients. Another way, we can involve a lot of structure studies in those research. So for example, if we found some chemical is very promising, we can sew structures together with this special gene called HLA-DP2 to see how drug bind to these molecules. So we have the base to improve these chemicals. And also these small drugs. And the other way, we can just do circles, make those drugs more potent, and eventually can be used for patients. And also, hopefully, can also use for preventing some disease. For example, if you have this gene, if you have this chemical, and if you have this chemical to block this gene, you could even prevent the disease. So this is our plan to do. And we already have some very interesting leads. So we are this grant from Boettcher give our very good opportunity to pursue and also hopefully create some jobs in the future for the drug industry. I mean that's a very bold imagination, but that's might happen. So you never know. Thank you again, Boettcher Foundation, and also Web Warning Foundation, and for your support. Thank you very much.